Chemotherapy principles, mechanisms, goals, and clinical applications. Chemotherapy represents a cornerstone of cancer treatment using pharmacological agents to target malignant cells. Understanding its principles, mechanisms, and therapeutic goals is essential for informed patient care. Understanding chemotherapy, definition and scope. Chemotherapy encompasses a broad category of cancer treatments that utilize one or more pharmaceutical agents specifically designed to combat malignant cell growth. These treatments form a critical pillar of modern oncology, working through various biological mechanisms to either eliminate cancer cells or impede their proliferation. The field of medical oncology, dedicated to the pharmacological management of cancer, has evolved considerably over the past several decades, with chemotherapy remaining a foundational therapeutic approach. When oncologists prescribe chemotherapy, they typically administer these medications according to established treatment protocols that have been rigorously tested for safety and efficacy. The versatility of chemotherapy lies in its ability to target cancer cells throughout the body, making it particularly valuable for treating systemic malignancies. Primary treatment objectives and goals. The overarching goals of chemotherapy vary considerably depending on the specific cancer type, stage of disease, patient health status, and overall prognosis. Oncologists carefully consider these factors when determining the most appropriate therapeutic strategy for each individual patient. The primary objectives fall into three distinct categories, each with different implications for treatment intensity, duration, and expected outcomes. Understanding these goals helps patients and healthcare providers align expectations and make informed decisions about pursuing chemotherapy. The selection between these objectives fundamentally shapes the entire treatment course and patient experience. Key points: curative intent, chemotherapy administered with the goal of achieving complete remission and long-term survival, typically applied in earlier stage malignancies or those with higher response rates to treatment. Life prolongation, treatment designed to extend overall survival when cure is not achievable, slowing disease progression and delaying mortality. Symptom management, palliative chemotherapy aimed at alleviating cancer-related symptoms and improving quality of life without expectation of cure. Mechanisms of chemotherapeutic action. Chemotherapy drugs operate through diverse biological mechanisms that disrupt cancer cell survival and division. These medications target fundamental processes that malignant cells depend upon to grow and proliferate uncontrollably. Different drug classes have evolved specifically to exploit vulnerabilities in cancer cell biology, each offering distinct advantages and challenges. Understanding these mechanisms helps oncologists select appropriate agents for particular cancer types and patient populations. Modern chemotherapy often combines multiple drug classes to achieve additive or synergistic effects, enhancing treatment effectiveness. Key points: DNA-damaging agents, medications that directly damage cancer cell DNA or interfere with DNA synthesis, preventing cell replication and triggering apoptosis. Antimetabolites, drugs that interfere with nucleotide metabolism and DNA/RNA synthesis, disrupting the cellular machinery necessary for growth. Topoisomerase inhibitors, compounds that target enzymes essential for DNA unwinding and replication, causing lethal DNA breaks. Microtubule targeting agents, medications that disrupt the cellular cytoskeleton, preventing proper cell division and chromosome segregation. Chemotherapy administration and treatment regimens. Chemotherapy delivery involves carefully orchestrated administration schedules designed to maximize therapeutic benefit while minimizing cumulative toxicity. Oncologists develop individualized treatment plans, often called regimens or protocols, that specify which drugs to use, in what doses, and at what intervals. These standardized approaches have been developed through years of clinical research and represent evidence-based best practices for different malignancies. The dosing and scheduling of chemotherapy reflect a balance between achieving adequate tumor cell kill and allowing normal tissues to recover between treatment cycles. Factors such as organ function, prior treatments, and overall health status influence the specific regimen selected for each patient. Key points: intravenous administration, the most common route, delivering chemotherapy directly into the bloodstream for rapid distribution throughout the body. Oral administration, allowing patients to take chemotherapy at home, improving convenience while maintaining therapeutic levels. Intrathecal delivery, direct injection into cerebrospinal fluid for treating central nervous system malignancies. Regional administration, localized delivery to specific body areas, such as hepatic artery infusion for liver cancers. Clinical decision-making in chemotherapy selection. Selecting appropriate chemotherapy requires comprehensive assessment of multiple clinical factors that influence both efficacy and tolerability. Oncologists must integrate tumor biology, patient characteristics, and treatment evidence to develop optimal management strategies. The decision-making process involves careful consideration of cancer stage, histology, molecular characteristics, and patient age and fitness status. Prior treatment history significantly influences drug selection, as previous chemotherapy exposure may affect both efficacy and tolerance of subsequent regimens. Patient preferences regarding treatment intensity and quality of life considerations also play important roles in these complex decisions. Side effects and toxicity management. Chemotherapy's mechanism of action, targeting rapidly dividing cells, inevitably affects normal tissues with high cell turnover rates, resulting in various side effects. The severity and specific types of toxicity vary depending on the chemotherapy agents used, cumulative doses received, and individual patient factors. Modern supportive care has substantially improved the tolerability of chemotherapy, allowing patients to maintain better quality of life during treatment. Anticipating and managing side effects proactively often improves treatment adherence and outcomes. Healthcare teams employ various strategies to minimize complications while maintaining therapeutic drug exposure. Key points: hematologic toxicity, bone marrow suppression causing anemia, thrombocytopenia, and neutropenia, increasing infection and bleeding risks. Gastrointestinal effects, nausea, vomiting, diarrhea, and mucositis resulting from chemotherapy's impact on rapidly renewing intestinal epithelium. Cardiac toxicity, potential myocardial damage from certain chemotherapy agents, particularly anthracyclines, requiring baseline and serial monitoring. Hepatic and renal effects, organ dysfunction from chemotherapy metabolism or direct toxicity, necessitating dose adjustments and careful monitoring. Response assessment and treatment monitoring. Evaluating chemotherapy response involves systematic assessment of tumor burden, patient tolerance, and treatment-related complications. Healthcare providers use imaging studies, laboratory tests, and clinical evaluation to determine whether treatment is achieving desired objectives. Response assessment typically occurs after several treatment cycles, allowing adequate time for tumor response while minimizing unnecessary exposure if treatment proves ineffective. Response rates vary considerably depending on cancer type and patient factors, with some malignancies demonstrating high responsiveness while others show more modest responses. Early recognition of inadequate response or intolerable toxicity allows oncologists to modify treatment strategies before excessive harm occurs. Evolution of chemotherapy in modern oncology. Chemotherapy has evolved substantially from its origins as a relatively indiscriminate cell-killing approach to increasingly sophisticated, targeted interventions. The development of combination chemotherapy regimens significantly improved outcomes for many malignancies by exploiting synergistic effects between different drug classes. Integration of chemotherapy with other treatment modalities, including radiation, immunotherapy, and targeted molecular therapies, has enhanced efficacy for numerous cancers. Advances in pharmacogenomics and molecular profiling increasingly allow personalization of chemotherapy selection based on individual tumor characteristics. Contemporary oncology increasingly incorporates chemotherapy alongside emerging therapeutic approaches, tailoring regimens to optimize outcomes for specific patient populations. Special considerations in chemotherapy practice. Various patient populations present unique challenges in chemotherapy administration that require modified approaches and enhanced monitoring. Elderly patients often have reduced organ function and comorbidities affecting drug metabolism and tolerance, necessitating careful dose adjustments. Patients with significant organ dysfunction may require alternative regimens or dose reductions to prevent unacceptable toxicity. Pregnant women present particularly complex situations requiring careful assessment of fetal risks versus maternal cancer treatment needs. Drug interactions between chemotherapy and other medications require systematic evaluation to prevent serious complications. Healthcare teams must also consider psychosocial factors, as treatment tolerance and outcomes are influenced by emotional well-being and social support systems. Long-term outcomes and survivorship considerations. Improving numbers of cancer survivors demand attention to potential long-term consequences of chemotherapy treatment. Some survivors experience late-onset complications years or decades after completing therapy, including secondary malignancies, cardiac disease, and cognitive dysfunction. Healthcare providers must develop systematic surveillance strategies to detect these complications early and implement preventive measures when possible. Fertility preservation before chemotherapy becomes increasingly important for younger patients who may desire biological children after cancer treatment. Quality of life assessment extends beyond active treatment, recognizing that chemotherapy's physical and emotional impacts influence long-term survivorship experiences. Comprehensive survivorship programs help cancer survivors optimize health outcomes and psychological well-being following treatment completion. Thank you for watching. For the full article, visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.